Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about outcomes from breast cancer, specifically the one that really matters the most, and that's all-cause mortality, or the likelihood of somebody who has dying from anything, whether that's breast cancer or heart disease or anything. So there's a lot of games and tricks we play with cancer treatment, things like progression-free survival, which generally doesn't really mean anything. It's overall survival and all-cause mortality, meaning certainly dying from breast cancer is important, but if the chemotherapy kills you and you die from a heart attack as a result of heart damage, like that's just as important. So all-cause mortality is what we're looking for. It's 5-year survival rates, it's 10-year survival rates, it's everything that we want. We want to survive what is generally considered the worst thing that can happen to us. So this particular study looked at something called the allostatic load, which is it's just a couple definitions, but generally the cumulative burden of chronic life and stressful events. So there are things that happen to us, things like social economic status, things like racial tensions, things like education, income, all of those things that play a role in our quality of life. It's one of the reasons why I've spoken so often about socioeconomic status, because few things have a potential to be improved and impacted on chronic diseases. It was one of the things with COVID, is that we wasted so much money, billions of dollars, on just wasted stuff, plexiglass, when we could have been putting it towards putting farmers markets in low-income areas. Like, that would have been a brilliant move financially. So looking at allostatic load in this particular study of breast cancer, women with breast cancer, they looked at those who, and they accounted for what's called the Charlson comorbidity score, basically obesity and diabetes and all these other things that increase the risk of dying. So even after that, this concept of allostatic load is, for those overall, those with a lower load had a 50% lower all-cause mortality. When you compared the highest quarter to the lowest quarter, is an 80% reduction in those in the lowest quarter. That's staggering. And that becomes the principal guiding factor for whether or not somebody's going to survive from breast cancer. So to put some of these in perspective, the authors looked at different markers that are representative of allostatic load, in particular cardiovascular, heart rate and blood pressure, metabolic, so looking at BMI, marker in the blood, ELK phos, blood glucose, and albumin. They looked at renal health, different markers of how healthy the kidneys were, and finally they looked at white blood cell count. So using those as a marker of allostatic load and how much our environment plays a role in these markers, this is how they determine the 80% reduction in all-cause mortality. So the take-home message is that we should be focusing on not necessarily, certainly chemotherapy or whatever is important, but we waste so much money on treatment or without focusing on these real things that improve outcomes, and improving socioeconomic status, and then its resulting effect on diabetes and obesity and heart disease it's money well spent, but it's not money that we spend. So, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.